In New South Wales overnight, and Dr Chant will provide details of this, we had 7 cases. 2 of them were from hotel quarantine, and 1 was the guard that was mentioned yesterday, so an additional 4 from community transmission. New South Wales is doing okay, but we need all of us to be vigilant, and I want to thank the 19,500 people that got tested in the last 24 hours. That is really positive, and especially in southwestern and western Sydney, we really need people to come forward and get tested. In the daily brief that I received today, it was noted again that we're concerned about the level of community transmission, which may be actually happening in southwestern and western Sydney, and we really need people in those areas in particular to come forward and get tested. Thank you to those that have. But even with the milder symptoms, if you're from Western Sydney or southwestern Sydney, please get tested and stay home for 14 days if you're told to do so. It's so important for us to make sure we stay on top of it. Can I also please thank everybody who has taken the health advice in relation to wearing masks. The briefing I had from Service New South Wales demonstrates there is greater take-up of masks, especially in hospitality venues where people are working in that environment. And can we please in particular encourage hospitality venues, so people who work in cafes, restaurants, hotels, clubs, to make sure their staff are encouraged to wear masks. The take-up has been pretty positive in the last few weeks, but that is an area where we would like to see people wearing masks. Obviously to protect the staff, but also to protect the patrons, because unlike other venues where there might be casual contacts, if you're actually in one of those venues, you're likely to be there for a longer period of time. And we want to make sure that the staff, but also the patrons, are given every opportunity to protect themselves from the virus spreading, and that is really critical and really important. Again, New South Wales continues to hold the line. We continue to make sure we reduce the spread as much as possible. But as was reported yesterday, and as Dr Chant has been saying, we do have around 15 or 16 cases that we've experienced in the last 6 weeks that still don't have a confirmed source. They're part of the same strain, but they don't have a confirmed source as to where the virus was acquired, and for that reason, we're really encouraging people in southwest and western Sydney to come forward and get tested.